Go ahead. Ask Teja.
Yeah, Teja.
A very good evening to one and all. We warmly welcome you to the Decan Positive Mental Health webinar series. It is our privilege to extend a heartfelt welcome to Professor D. Srinivasan sir. He is a renowned consultant psychiatrist and medical director, celebrated as the pioneer of positive psychotherapy. With over 40 years of experience, he leads the Kastubra Gandhi De-Addiction Center and founded the Global Academy for Total Empowerment. His Potential Maximizer program and lifelong work in mental health continues to inspire growth and well-being. I call upon Sir to start today's session.
Sunanda, mute everybody except the speaker,
Yes, sir. Yes.
please. Go ahead, sir, doctor. Doctor, you go ahead.
One minute, I'll just stop sharing and video and put it off. Good evening and thank you for the opportunity. Sorry for the difficulty. I couldn't, because of bandwidth issues, I am off video, excuse me. And thank you for this wonderful opportunity to talk to all of you on this World Mental Health Day. In fact, this morning we had a panel discussion. And today I have chosen a completely new topic, Wandering Vegas, Why and How. In fact, this theory which I was interested, but some of my personal experience and stress, and because of that, I experienced a lot of things in the last 30, 40 days. And when I really wanted to overcome that, and we went into a deep dive into this, and that really helped me to understand a lot of things. So out of pain, this thing comes, and I hope it's really useful to all of you. This is called polyvagal theory, proposed by Steve Borges in the 1990s. So that's what I'm going to be talking about today. So this provides a framework for understanding how our nervous system governs our capacity for safety, connection, and healing. That's the reason why I have chosen this. And why wandering Vegas? Because it's a double. Vegas itself means it wanders through the entire body, probably one of the cranial nerves out of the 12, which connects almost most of the organs, and it has both afferent and efferent system. So it's intimately connected with our lives more than any other cranial nerve. That's the reason why I have chosen this. And in the central model, this function shapes how we respond to the world, whether through openness or defense. We have always talked about fight or flight response and then the freeze response. They are the fundamental basic defense responses. And from there, we move to what's called the ventral vagus, where we talk about connection, openness, communicate, future planning, everything. Can you please mute others?
The list is there. Sir, I know to write out all the 26.
Continue. Sorry, sir. I think people are not
no
realizing.
problem.
Continue.
So, in today's context, the theory resonates more than ever because the emotional regulation is not achieved through willpower. We are talking about emotional regulation. In fact, DBT talks about emotional regulation, dysregulation. We talk about cognitive distortions, cognitive reframing. We concentrate more on the thinking part, we concentrate more on the emotion part, but unless otherwise we take care of the nervous system and how the body feels, because they say there's an excellent book called Trauma Keeps This Body Keeps the Score of all the trauma. So the body and its reactions post-trauma, how the nervous system goes more into the defense mode or the hyperactive mode, overthinking, fights, or completely withdrawn. All these things come from that.
Sir, you're in mute, sir.
Sunanda, unmute Dr. Srinivasan.
Yes,
Sunanda.
sir. Yes, sir. Yes, yes.
Audible?
Shailaja, wait.
Yeah,
So-
Bhuvaneshwari ma'am, please mute yourself, ma'am.
Am I audible now?
Now
Yes,
audible,
sir.
sir.
Yes.
Did I go out of the...
No. We are in the first slide only, sir.
Okay, no, first slide, but whatever I taught, okay, it was...
Yeah, we couldn't
Okay.
listen to that.
Okay.
Except some book about a book you have quoted, drama book or something.
No, that's about the body keeps the score. That's what they
Yeah.
see. So unless otherwise we understand the body and
Yes.
how it reacts, it's difficult to regulate the emotions or regulate the thinking, because we talk about cognitive distractions and how to correct cognition. We talk about emotion dysregulation and emotional regulation. But unless otherwise we focus on the nervous system and how it changes the body, how we understand the states of the body, then it's difficult. So that's where we understand the rhythms, and we also help our clients move from patterns of protection to pathways of connection. That's where it's important. So beneath every behavior lies a nervous system doing its best to survive. So survival mode, we immediately switch over to survival mode whenever we perceive a threat. That's where the whole issue is. So safety therefore becomes the essential therapeutic currency. Once safety is established, change follows naturally. We bring compassion to the body's response and curiosity to its pattern. So that's why even today I was talking to my assistant about what's rapport. We are talking about establishing rapport. The definition says conscious flow of harmonious emotions. But most of the time, the rapport is established through a lot of things. Both the therapist and the client may not even understand. But when the client feels comfortable in your presence, the connection is established. When the client doesn't feel comfortable, doesn't feel connected, then whatever you do doesn't pass through. In fact, I have this experience on a daily basis. There are a lot of people who are more interested in talking, expressing themselves, but not ready to receive what you want to say. So, unless otherwise they are ready, they are connected, they feel they are understood, they feel that they can open up and are ready to receive. So, these are the states we need to make the client ready. So why polyvagal theory matters now? Because it reframes clinical work around regulation rather than pathology. Clients don't come with a diagnosis, they come with the nervous system in distress. So this is the focus. We are changing. We don't look at the symptoms, we don't look at their thinking, we don't look at their emotions, but we understand a nervous system that's in distress. So we are trying to change the focus, like at CBT, the focus is something, DBT, the focus is something, marital therapy, the focus is something. But I'm going to say that the focus is on the nervous system. If you understand where they operate from, in a minute from now, I'll come into that dorsal vagal system, sympathetic system, and ventral vagus system. These three words you'll be hearing very often. And the aim is to keep the individual in the ventral vagal state. Both the dorsal vagal and the sympathetic state are going to be the troublesome states, but it's natural for them to move from there one to other. So that's what we are going to talk about it. So when the body senses safety, insight and learning becomes accessible. So our job is to make the individual feel safe in our presence and also develop an awareness for the individual to know how the body keeps moving from these three states, and when they feel insecure, when they feel secure, when they are ready to learn, when they are ready to connect, all these things. So understanding the nervous system states transforms how we conceptualize healing, moving beyond symptoms to the physiological foundations of well-being. So, polyvagal theory therefore centers on co-regulation. So, for that, the therapist has to be like calm, composed, feeling connected. So, the therapist in distress, there are some people automatically they elicit a different response. In some clients, with some clients, you feel very comfortable. Some clients with their past uh, behavior or certain other things, you are not grounded and connected. So they can sense that as well. So this is what the therapist needs to understand the state they are in, and also how we are able to create a state of connection and keep the individual calm and feel that they are able to come out of distress. When they are in height of distress, when their sympathetic system is active, they are hyperactive, or when their dorsal vagal system is active, they are completely withdrawn. They will not be in a position to receive what you are saying.
गाँव जा रहे हैं
They are not going to get connected.
नहीं पर वो तैयार हैं
You
दिखाने
need
के
to
लिए
understand. So the nervous system as the master storyteller. So our autonomic states determine the story we tell about ourselves and the world. When we are safe and connected, our stories are hopeful and coherent. When our system is in fight, flight, or freeze, our stories turn fearful, fragmented, or despairing. So there is a concept called neuroception, which is an unconscious threat detection, because whenever we are in a heightened arousal, our body is scanning for threats because of the trauma or because of the recent stressful experience or 2-3 stressors have occurred within a short time. Your threat detection system is in a very high mode, so it receives. So your facial expression of the therapist or some noises or even some bodily changes, automatically it's detected. Once the threat is detected, the understanding shifts therapy from content to process. So the autonomic state produces a physiological response. First is there is a threat detection that leads to the autonomic state producing a physiological response. It may be a rapid shallow breathing or increased heart rate or excessive sweating. In fact, I used to oversimplify and say, if your hands and palm and sole are wet, your sympathetic system active. If your mouth is wet, there is a lot of saliva, that means your parasympathetic or ventral vagal is better. So, once with the threat perception, there is a autonomic nervous system change that leads to an emotional experience, which is uncomfortable, distressful, or that, and that leads to a meaning, and you start telling what's happening. Something wrong is happening. I'm going to die, or something is going to happen. There is a feeling of impending doom. There's so many things. So when the threat detection is not there, when you feel safe, when you feel connected, when your system is different, your feeling is better, and you have a different story, narrative. So this is how the stories keep changing. If your threat perception is high, there is a negative story. If your threat perception is not there, you feel safe and connected and comfortable, then you have a positive story. This is what you need to understand first. So our autonomic state the stories we tell about ourselves and the world. So I am safe, I am comfortable, or I am not safe, I am uncomfortable. And the world is threatening, or the world can be relied upon. So the beliefs come from the unconscious perceptions. So why somebody feels safe and connected, why somebody feels unsafe and disconnected or threatened, it's sometimes unconscious perception of the threat. So the states precede the story, change the nervous system, change the narrative. This is the essence of this. So who started all this? Stephen Borges introduced polyvagal theory in the 1990s, much later than all those other things they started. But that revolutionized our understanding of the autonomic nervous system. So the key insights from Stephen Borges' polyvagal theory is that psychology meets physiology. The vagus nerve wanders throughout the entire body. Connection is biological imperative. Safety detection happens below consciousness. So this theory shifted focus from pathology to the nervous system regulation as the foundation of the mental health. So whenever somebody comes out with the theory, then they say everything is relied upon that. So today I'm going to focus on the nervous system regulation. So the insight provided a neurobiological explanation for the power of relational safety. This complex science into clinical language, emphasizing that therapy begins by helping clients befriend their nervous system. So, before understanding your thinking, before understanding your emotions, you befriend your nervous system, you befriend your bodily changes, you first develop an awareness and become conscious, and you are able to detach and understand the difference and move from one state to the other. By recognizing that how the body reacts to the threat and safety, clinicians can approach symptoms with empathy rather than pathologizing them. The theory offers a framework that links mind, body, and relationship into one integrated system. So the primitive protection. So first is the freeze when you are not able to escape, and then we are able to escape or fight, the fight or flight, the heightened autonomic system, and the mammalian brain is the one where it's a highly evolved, enabling the hierarchy consists of three primary states. At the top is the ventral vagal system, which you see on the right, which supports calm engagement, curiosity, and connection. Beneath it lies the sympathetic system, responsible for mobilization, fight or flight responses. At the base sits the dorsal vagal system, which governs immobilization and shutdown. So, sometimes when I was reading this, even I was thinking about how do you apply this in a relationship? Imagine a husband coming exhausted, he comes home. He is in a total withdrawal state. So his dorsal vagal system is active. Whereas the wife waiting for him all the time, she wants to talk, she's excited and he doesn't respond and she wants to fight. So her autonomic nervous system, mainly the sympathetic one, is hyperactive. So that leads to a lot of problems. Imagine both are in the ventral vagal state, then they have curiosity why so is behaving like that, and when they are trying to understand, compassionate, and trying to get, probably the relationship will be even much better. So in the workplace, everywhere I see that. So the understanding of these three systems and how they can be applied in every particular situation really opened up a great insight into me. This hierarchy is evolutionary. The ventral system is the newest and most adaptive, allowing humans to connect socially even in the presence of mild stress. The sympathetic system is older, designed for survival through action. The dorsal system, anxious and protective, shuts the body down to conserve energy when escape is impossible. Understanding this ladder helps both clients and the clinicians recognize that movement between these states is normal. First, you understand when you have the empathy with the individual, even two individuals in relationship everywhere, this movement is normal, which state the other person is in, and once you are able to understand that, that's why I always say, whenever there is a fight, the first person who realizes that stops fighting, stops responding, he even moves out. And after some time, the fight doesn't escalate. So this all comes with awareness and understanding. And this framework, see, each framework gives a totally newer insight into something and adds to our knowledge. And this probably framework gives an understanding of why somebody is withdrawn, why somebody is hyperactive and fighting, why somebody is willing to be curious, connect, and emote. So, this flexibility, learning to move fluidly rather than getting stuck in the state, this is what we need to teach to the client. And when clients can identify their states, they can choose tools to climb back towards safety. So the autonomic hierarchy, as I said, dorsal vagal is a shutdown and collapse, freeze, dissociation, depression, I cannot go. Like whenever patients ask, I used to say, when your sympathetic system is active, that's where anxiety is predominant. You are fighting. You are either trying to run away or fight, both creates anxiety. But when you give up, I cannot do anything, that's when depression walks in. But when you come out of these two and the ventral vagal state, you are able to move, you feel safe, you feel connected, you feel calm, there is a social engagement, joy, then you feel all is well. So, in order to move between these three states, you need to be aware first what happens in my body, in my mind, in my relationship issues, everywhere, and how I can move from one state to the other. The evolutionary hierarchy shows how we move between states of safety, mobilization, and shutdown based on perceived threat levels. That's why I said, like, whenever there is a threat perception, heightened threat perception, we need to make the patient become aware and then make them come out of it. So when stress pulls us down, under stress, the autonomic nervous system moves predictably down the hierarchy from ventral safety towards sympathetic mobilization. And if the strain continues into dorsal collapse. This descent is not failure, but it's by design because man did not come straight into the place where he is now. He was in the jungle, he was always under threat. Like he is sitting ready to take his dinner in the night, and by the corner of his eyes, he sees a tiger ready to prowl upon him. So, in a split moment, he has to act. If he doesn't, then probably instead of he taking the dinner, he becomes the dinner of the tiger. So, man is designed to perceive threat and escape for survival. So that threat perception, we are still living, though we have moved out of the jungle for so many years, but still the nervous system has not come out. So we are still living with an outdated nervous system unless otherwise we consciously take control of that and do regular practices to move towards the ventral vagal system. So connected, present, able to think clearly and engage socially. That's what is the need of the hour, and that needs regular practice. So if you don't do that, then it pulls you down to anxious, agitated, racing thoughts, difficulty concentrating, or you become completely numb, disconnected, hopeless, and difficulty engaging. So neuroception, that's the body's radar system. It always keeps scanning. So internal scanning is heart rate, breathing, muscle tension, gut sensation, So that's what gives rise to what we call health anxiety today, makes many hospitals run, many investigations getting done, because Google also feeds into that, Google search, and then they get into that. So now the social media and information input has increased this internal scanning. And whenever, like, well, mental health day doesn't get so much attention like cancer day or a heart day or any other disease day, because they have a lot of firepower. So their advertisements are all over, and most of the time, these are the early warning signs of a heart attack, these are the early warning signs of the cancer or something. So that has put every man and woman under stress. So this internal scanning is constant for most people. Then there is external scanning, environment cues and sounds and other things. Spatial dynamics is their safety, escape route, etc. And the relationship scanning, the facial expressions, voice. In fact, in one of my programs, I gave a very simple exercise on communication. Like I said, most of the time, instead of a dialogue, it's two monologues going on. Like most people don't even listen what the other person says. Like Stephen Covey says, most of the time you listen to respond rather than listen to understand. So I said, whenever you converse or a conversation is going on between two people, you just record, put it on a voice record, and then listen to it. It will give you a lot of insights. In fact, one of my very close associates came and said, like, this has given me a new insight, sir. Whenever me and my father talk, my father thinks that I am fighting, but I never fought with him. But now I realize why. Because my voice is little gruff, little louder. Because of the tone, he thought I am fighting or angry. So this has given me an insight. Like that, most of these things are at an unconscious level. That's the reason why we are unable to understand why something went wrong. But how the other person perceived that is totally because of their conditioning of years and years, and how they perceive is completely up to them. But this is what happens. The body's radar system with internal scanning, external scanning, and relational scanning. The unconscious system works 24/7, even while you're sleeping. Probably the thought process is going on what happened during the day. And because even while you're sleeping, you have to be safe. So this danger perception is all without conscious awareness. That's where the whole problem is. Trauma, if you have experienced trauma, trauma distorts this process, creating false alarms. Therapy, therefore, restores accurate neuroception through repeated safe experiences, voice tone, facial expression, consistency, warmth. Regulation is not taught cognitively, it is learned relationally. That's why I am focusing more on remove the cognition, thinking out of it, remove the emotion out of it, but bring more of subtle cues and how you relate with people. So this is what I talk about co-regulation. So we don't self-regulate in isolation, we co-regulate in relationship, then internalize that capacity for self-regulation. This is what, as a therapist, you teach. So your regulated state becomes the invitation for the client's regulation. So embodied safety is contagious, like how anger or negative emotions are contagious, the positive emotions are also contagious. So you give them the feeling that they are safe. So that leads to the client's response. The nervous system is attuned to each other. They gradually learn to trust and relax in your presence. Then the social engagement system comes. Our face, voice, posture constantly broadcast safety or danger cues to others' nervous system. So the face, voice, and heart, neural regulation. So it is the interface between physiology and relationship. When ventral vagal tone is active, muscles around the eye often, sorry. So when the ventral vagal tone is active, muscles around the eyes soften, The voice warms, the gesture becomes fluid. These signals invite safety. Whereas under threat, same circuits tighten, eyes harden, voice flattens, expression fades. So these features evolved communicate safety. The middle ear even tunes to human frequencies when relaxed, showing that listening itself is a physiological act of trust. Most of the time, that's why in the West, there are people just to listen, even not even for therapy. You patiently listen to somebody, gives a proper understanding, gives cues that you are listening to them, you understand what they express, that itself makes the other persons relax. Through this system, therapy becomes a dialogue, not only for words, but autonomic cues. This is what, again, repeatedly, what I'm saying is what is said and what's not said. So your body language, your voice, everything is important. Trauma in the nervous system is.
Go ahead, sir.
My audio is good?
Yes, okay, sir.
Because it says step up professional audio. So trauma represents a chronic disruption of connection, not just memory to process, but a nervous system stuck in the protective pattern. That's why we talk about trauma, complex PTSD, adverse childhood events. Why? There are some individuals who go through stress and they are comfortable with stress and they can handle it and move ahead. Whereas some people facing with the same stress, they are not comfortable and they are not able to move ahead. They get stuck, they react very, very badly, and sometimes they freeze. Like recently, I had a patient who had a complex PTSD. She says, whenever I hear sound, other things, I'm totally frozen for the half an hour. I just feel like I cannot even move my body, I cannot breathe, and I just shut my eyes. So I cannot speak, I cannot even listen. Somebody talks, I feel very, very uncomfortable. So trauma's impact leaves the nervous system biased towards protection, making safety detection difficult and connection feel dangerous. So that's why people with trauma, like you try to touch them, they are in a hyperarousal stage. So, like for them, you have to give a safe distance, make them feel safe first, then feel connected. So, like feeling safety is first, or feeling getting connected is first. I would say make them feel safe first and then get them connected. So, because they are at the lower order, like dorsal vagal or at sympathetic state, there you cannot connect them, so you have to make them feel safe because their threat perception is very high. So restore the nervous system capacity for safety, connection, and flexible movement between states. So that's where the whole thing is very, very important. So clinical application is focused on building safety and regulation before processing traumatic content or exploring difficult emotions. Because like clients are in a hurry sometimes, but they want to talk about it, but they are not ready to talk about it. But they are not even aware that they are not ready. That is where clients, uh, to make them understand, it becomes important for the therapist to know where they are, which state they are in the ladder. They are looking for safety or looking for connection, because the patient sometimes is confused. They don't know whether they are looking for safety or connection. When their threat perception is high, if they try to connect, that produce a jarring tone, like two musical instruments but out of sync with each other. They don't produce synchrony but dysynchrony. Like that, a therapist should be aware and should be in a better position to know which state the client is. So they are looking for safety or they are looking for connection, and are they ready to process their traumatic memories, or they want to feel safe first and then they want to come into this. So healing happens in relationship at the speed of safety through the felt experience of being truly seen and accepted. There is some. Okay. But all is not bad. Let's go into the hopeful news. Our nervous system, though resilient, is also remarkably plastic. This means that patterns of protection can be reshaped and new pathways are forged. So that's why we always talk about neuroplasticity. Even in brain injury, we talk about recovery. So the nervous system isn't fixed, it's constantly learning and adapting. So our job is to make this learning and adapting to be facilitated. So this inherent capacity for change is the bedrock of healing, allowing us to build new capacities for regulation and resilience, harnessing the power of glimmers. Glimmers is a new word I learned after reading into this. So, whatever finer moments, the micro moments of connection, joy, what we call glimmers, it may not be great, but somebody says with a smile, who smiled at you, like after this, I have started becoming focusing more in my therapy. And whenever somebody comes and says, Doctor, I'm doing well because of you or something, earlier I just took it for granted, that's the job I'm doing. But after reading these glimmer moments, I started paying more attention to it, and that gives me more happiness. So, our job as therapists is to give them more glimmer moments and also make them realize what are the glimmer moments and guide the nervous system back towards safety one small step at a time. So, make the client understand what's a glimmer moment and make them feel small moments of happiness and let them store it in them so that they can recall at will and make it better. So that leads to the basic framework. This was given by Deb Donna, who developed Steve Burgess' theory much further into therapy and all that. She constituted this what's called basic framework. Basic is must befriend, then attend, shape, connect, and integrate. So these are the 5 things she gave an acronym of basic framework. So cultivate compassion for your nervous system's protective responses, recognizing them as attempts to keep you safe. So first, instead of feeling these things as a threat, understand your body is trying to protect you. Once you reframe this, they will stop perceiving this as a threat. They will be able to come out of that threat perception. Yes, it's a change happening in me. Let me understand my body is trying to tell there is a danger. And for that, my body is reacting. Let me understand that. So that's the first step. Next is consciously notice your internal emotions, thoughts, and all that, and actively engage in practices. Then connect, engage in reciprocal relationship, and also integrate. I'll go into the detail one by one. First is befriend your nervous system. Begins with noticing without judgment. It is a practice of curiosity. As I said, curiosity is a part of the ventral vagus, but once you tell, okay, you notice with curiosity instead of feeling it as a threat. Once you teach your client how these threats can be looked with curiosity and you can befriend your nervous system, you create the foundation for regulation. So this is the first step. This transforms the therapeutic relationship. Instead of battling symptoms, therapist and client becomes allies in discovery. The body's responses are seen as messages rather than malfunctions. So once you are able to tell the individual, these threats are not malfunctions, they are not dangers, you can just look at it as your body is trying to give you a message that you are perceiving danger. It may be real, or because of your heightened awareness, you are seeing it as a danger. So let's just be neutral or with curiosity to look out what are the changes. The body's responses are seen as messages rather than malfunctions. By identifying the physical markers of these states, individuals learn to anticipate and normalize their shifts. So, first teach them these are the 3 states, and you try to understand which state you are in. And whatever state you are in, what are all the signals you are getting. So, can you move from one state to the other? So, awareness becomes the first tool of regulation. So, That is the most important thing to befriend. Second, attend. Attending builds awareness over time, observing how cues of safety and danger fluctuate across the day. Attention to state changes builds prediction and choice. So my state is going to change, now it's changing, where I am. So I am in the mobilized sympathetic state or shutdown dorsal vagal state or transitional neutral state or connected ventral vagal state. So once they become, so education is the key. So once you tell them these are all the processes, this is what is happening, your nervous system is doing all these tricks. So once you can see where you are and you're also feeling comfortable and you start thinking that you can take charge of it, you will not stay here permanently, you can move from one state to the other. This attention becomes the most important thing. Then come shift, actively shifting your state. That's the most important thing. It involves using tools such as breathing, movement, rhythm, and sound to influence state. That's why they say body movement therapy, music therapy, breathing. In fact, the mindfulness and breathing seems to be the central, what started from Buddha. It becomes institutionalized now, and there are so many breathing practices. The basic key, I looked into a lot of practices involved with what makes the anchoring into the ventral state, breathing, inhalation, shorter inhalation, and longer exhalation. And some people talk about holding the breath in between. So almost everybody teaches, they have different ways, but at least 4 counts inhalation and 6 to 8 counts exhalation. Once you start doing it, that anchors into ventral vagal. That's the most important thing. And whenever you feel anxious, you just do this kind of breathing pattern. You become aware of your own breathing when you are in a ventral vagal state, when you are in a dorsal vagal state, when you are in a sympathetic autonomic hyper-aroused state. So once you become aware of that, then you start changing it deliberately, consciously, then you will be able to move from one to the other. Then the mindful movement, in fact, the physical activity from gentle stretching to walking, that's where the yoga comes, can release stored tension and complete protective physiological responses, helping to discharge excess energy and promote sense of agency. Then auditory engagement, that's where the sound comes. So gentle humming and also the grounding touch, everything. By consciously integrating these practices, we build resilience and increase our capacity to navigate life challenges. So then integrate. Once integrate in the process, weaving new experiences of safety into body's implicit memory. It's not enough to touch safety briefly. The nervous system must link it to past survival experiences so that the story of the self expands. The weaving together of survival and safety stories until they coexist without conflict. This is the most important thing. True integration fosters profound resilience. It's not about avoiding stress, but about strengthening your nervous system ability to bounce back with greater ease and speed, transforming moments of overwhelm into opportunities for growth and deeper self-trust. So, like they say, whenever there is a obstacle, make it as a stepping stone. So, like that, whenever you feel stress, you are able to feel that stress, and then you feel confident that you can come out of the stressful state by altering that by your breathing, your movement, or music, or feeling connected with the person. That's the whole thing. Then, of course, connect. Connection is the ultimate expression of a regulated system. When the ventral vagal network is active, curiosity, compassion, and engagement emerge spontaneously. So that's the world. So connecting with the self first, connecting with others, and connecting with the world. So meaningful engagement with a broader community, empathy, attunement, and relational process with others, and internal regulation and bodily safety. When you connect all this, then that works wonderfully. So once you have done this, then you befriend the hierarchy with this basic system. So understanding your personal nervous system hierarchy is a powerful step in cultivating self-awareness and regulation. And by recognizing this physiological signature of each state, you gain the ability to navigate them with greater intention. So what's ventral vagal? Safety and connection. Sympathetic is mobilization and action. Dorsal vagal is shutdown and immobilization. So then the autonomic trees. So like deep roots, like a tree you draw down. Okay, once you draw a tree, this exercise uses metaphor to anchor the hierarchy in imagery. The roots represent the dorsal state, grounding, but also withdrawal. The trunk symbolizes sympathetic energy and action. The branches and leaves embody the ventral connection. Drawing this tree personalizes the theory. So this visual exercise encourages us to map our own experiences onto the structure. By identifying which part of the tree we are in, we can befriend better, understand our body's wisdom, and choose appropriate strategies for regulation. Consider sketching your own autonomic tree, noting personal sensations, thoughts, and behaviors associated with each level. Also, the autonomic alphabets, like in the ventral vagal state, A stands for attune, feeling present and connected. In the sympathetic state, A stands for alert, heightened sensory awareness. In the dorsal vagal state, A stands for absent, feeling detached. So B for breath, deep, calm, and effortless respiration, whereas sympathetic is busy, sense of urgency, needing to act all the time. B for completely feeling blank, a mind devoid of anything. C for curious, open to new experiences and learning. In sympathetic state, C for charge, feeling energized, often restless energy. There it's C for collapse. Then D for delight. In the sympathetic, it's D for driven, and in the dorsal vagal state, it's disengaged. So by consciously building these personal lexicons, we gain more sophisticated understanding of our internal landscape, empowering us to more effectively and apply targeted regulation strategies. Then autonomic short stories. In the calm state, sudden rain shower brought a fresh earthy scent to the air. I pulled out my umbrella, enjoying the rhythmic drumming of the fabric, feeling grateful for the unexpected sensory experience and the cozy warmth of my sweater. The same rain, but the ventral vagal in a calm state, you enjoy that. We see some people go out and dance in the rain. Whereas the sympathetic person, the sudden downpour ruined my hair, my schedule, my heart pounded, and I worried about being late, frantically searching for shelter and feeling an urgent need to escape and chaos. Whereas in the dorsal vagal state, the rain started, I just started feeling heavy and numb, the world around me, and I couldn't seem to move, feeling profoundly exhausted and dissented. So, by understanding these distinct narratives, the same event, but here in a different state, how your stories are. So, the autonomic short stories are different according to the state you are in. So, applying your autonomic map. So, map your states and then expand your language, rewrite your narrative. So, breath mapping, again, ventral vagal, safety and connection. How is your breath? Sympathetic, mobilization and action. How is your breath? And dorsal vagal, again, how? Paying close attention to these subtle changes in breath, its rhythm, depth, and location offers direct access to your nervous system's current state. This awareness empowers you to consciously shift towards regulation. Then shaping breath. Like once awareness is established, shaping begins. Simple and most effective form is elongating the exhalation. As I told you, A slow out-breath activates parasympathetic system and engages the vagal brake, a mechanism that slows the heart and restores calm. The heart rate variability, again, an important factor which tells us how the parasympathetic nervous system works or whether sympathetic nervous system is overactive. When you take an inspiration, the heart rate increases, and when you go into an expiration, the heart rate decreases, comes down. So that's why you breathe in and then breathe out at least for twice the time, your heart rate automatically slows down. So your breathing is regulated, your heart rate is regulated, and everything else is regulated. So somebody with a palpitation, increased awareness about the heart, my heart is beating, pounding, I'm going to die, I'm going to choke, that kind of thing. Somebody comes in a panic, again, this helps them to restore immediate safety in them. Then, of course, the labyrinth walk with an awareness, mindfulness again comes into the play. You start doing it, that also brings into awareness. Then, anchors of safety, like what are all the trusted names, like what are all the cues for safety, the people, places, sensations, or memories that evoke calm connection. The persons you can think about, yes, that person is giving me a hug and I feel comfortable, I am safe, I am safe in this place, I am safe with this sound, I am safe in this place. What are all the objects that gives me a sense of safety? Like that, like Brian Tracy used to talk about success wall. You can bring in, probably have an anchor, have the image of an anchor, and also attach things like you can attach people, you can attach places, you can attach sounds or memories, whatever it is. And whenever you recollect, it gives you a sense of safety that's anchoring into safety. So, are you going to be longing or are you going to be belonging? That's the most important thing. Because belonging is a physiological state, not a social label. The nervous system recognizes belonging through predictability, resonance, and safety. Mapping clusters of connection, family, friends, community, helps clients visualize where safety lives and where it falters. So, this one is very, very important. Are you going to be belonging or be longing? Then, of course, the awe practices. In fact, whenever I talk to youngsters now, I used to say that people have lost the capacity to feel awe, get inspired. Like everything, they take it for granted. You give them something new, they don't even get excited for a second. Yes, like a sense of entitlement has taken the sense of awe. Instead of that, you come out and you start experiencing, you see a good natural scenery, a good music, art, sacred moment, art softens defenses and quiets hypervigilance. So when you are in a like not excited but awe is little different, when you feel that, then you feel calm, you feel connected with that whatever experience, and that actually reduces the heightened awareness. So once you do that, you do this progress tracking using a daily reflection log, pattern recognition, celebrate small wins or what I call the glimmer moments, and also adjust and adapt. So once you start doing that and keep tracking the progress, because like you don't achieve it in a single day, you do it as a regular practice, then you keep tracking it week 1, week 2, week 3, week 4. Or you go, I mean, it may not be a steady progress like this. Sometimes there may be ups and downs if you don't have time to practice or you fall back. So you need to keep tracking your progress. That's the most important thing. It normally probably takes about 3-4 months of real intense work, spending time every day, becoming aware. Then definitely you will be able to do this. So with that, you will be able to ultimately start a completely new narrative from fighting for survival to moving into curiosity and connection, rewriting the body story from protection to connection. As neuroception shifts, so does the meaning of experience. Each moment of regulation is a new sentence in the story of safety. So encourage reflection on what feels different now. What does the nervous system know that it didn't before? The nervous system is not healed by erasing its history, but by integrating it into the story of survival and belonging. You don't forget anything, you don't erase anything, you don't remove anything, but you reintegrate. That's the most important thing. The journey moves up beyond merely surviving to truly thriving. So, in fact, even parenting, we talk about surviving to thriving, how we are going to make your children ready. So, if it starts at the parenting level, this kind of awareness, then that produces wonderful children. So, our clients are our children, and so we need to be the parents and we need to create a life rich with presence, safety, and heartfelt interaction. So that's it. The story ends there. And now I was just rushing through because of time factor. Hope I am in time and we have time for some questions. Over to Sunanda.
Thank you, sir.
That's
I
almost a
think today we
rapid
are
fire
blessed to
session.
hear your voice.
Wonderful session, Dr. Srinivas. Top class. And which we are not aware of these things.
Yeah. This was new to me. I was aware. I didn't dive deep into it until a personal problem struck me, and that made me understand more about stress and ventral vagal brake. And I needed that personally. And last 45 days, I was struggling through a lot of things. In fact, when Sunanda asked me, I didn't agree very readily because the initial stage I was not ready to do that, but then I committed and I thought I'll get well before that, and I am here today.
Fantastic.
Thank you very much, sir. Beautiful, amazing, very, what should I say, revealing
Insightful.
session to oneself.
Yes.
Lot of learnings. Thank you very much, Mr. Srinivasan.
Actually, wandering Vagu, I thought you are going to talk about a Vagu monk, some monk wandering and exploring. Then I found out it is a different thing. Thank you very much.
Monk is inside. Wandering is inside. So all of us are monks and it's wandering inside and we need to take charge.
Correct.
Right.
Sir, I would like to get in touch with you after the session briefly.
Sure,
for 2
sure.
3 minutes if it's okay.
Okay. Right.
Thank you, sir.
Yeah, friends. If you have any doubt regarding today's session, you can interact with sir.
Time
Now,
for questions and then probably we'll
yeah. Now the forum is open to QA session. You can ask sir regarding today's session.
You want to ask something?
Sir, actually, I was just thinking of whether I can get a PPT for this.
Yes,
Yeah,
sir.
I'll see
I can practice.
how I can do that. Because I'll see whether I can do that. I'll check up.
If possible, share with Sunanda. She will get it in the group.
Please share to Sunanda, madam, sir.
Okay, right.
Yeah, we will share in groups, sir. No worries.
Okay.
With our permission, we will share. Yeah, others can interact with sir. They can ask doubt.
Devi Srinivas, you want to ask something?
That PPT also on, sir. So that's why I'm
Okay,
asking.
we will get it.
Actually, I'm busy to listening from also.
Okay. What, Sarija? Arvind?
Good evening, sir. Thanks a lot. Vanakkam, Dr. Srinivasan, sir. Thanks to Sunanda, madam. Srinivasan, sir, you taught us from A to Z about autonomic nervous system to make a friend, to be a friend, belonging to that our culture and curiosity. Being a D for doctor, you explained a deep explanation and educated us to be a friendly way. And thanks a lot. And you explained everything in a safety way, how to do with the glimmering that too, which glimmers us. And related to yoga also, you reminded us how the breathing exercise will be helpful to the client.
Yes.
And yours is so joyful, sir. And we can love.
Thanks for that. Wonderful. So this is a glimmer moment for me as well. Thank you.
Only one. Go ahead.
You improved our love towards our profession too, sir. And giving this opportunity, we are so grateful to. In a short time, you prepared very good presentation, sir. Wonderful. And being a parent also.
I have to thank my friend Dr. Vikas, who made it using AI, this slides. I just gave content to him and he made it and sent it in a day. Like otherwise, it's very difficult to make such slides. He made it for me. Dr. Vikas is a psychiatrist in Chennai who actually runs a program called Manthan and things like that. He's youngster, is very, very tech savvy. And I have to place on, thank you for giving me an opportunity to place my gratitude and thanks for Dr. Vikas and to mention his name here. Thank you.
Romba nandri, sir.
Thank you.
Only one suggestion, continuing what Shailaja said. Breathing exercise in pranayama, the concept is 6, 7, 8. 6 inhale, 7 hold, 8 exhale.
No. The numbers are not constant here. Nobody has any validity on thing. So
Yoga says like that.
No. Each yoga probably will have different things. There is no one yoga and one pranayama. So when you say breathing exercises, there are thousands of breathing exercises. That's what I said. Inhale shortly, exhale long. So it can be 4-8 twice or like 4, like what these people say is 4 inhalation and 6 exhalation. But when I deep dived into many of the breathing exercises, they said like 4 and 8 is better. Some people say about hold, some people don't talk about holding. And some people say about even after exhalation, you hold some people. So there are a lot of different variations on this. That's why I didn't go deeper into it. I made it oversimplified. Inhale for 4, exhale for 8. That's it.
Hello, doctor. Hello, doctor. This is Kartigaini. You know me well.
Yes.
I'm very happy, doctor. Actually, I don't know. It's what I really don't know what makes to attend this session. Initially, I completely numb. I don't know what you're speaking, but later on, I can able to understand what you're coming to say, like what you want to convey us. I don't have any biological background or anything about this nervous system or anything else, but I can able to understand. Your teaching was like that. Even unknown can able to understand what is what the message is. I'm very happy for that. And I had a question. Okay, he's telling that I'm noting down everything and I'm writing. I need to ask this question. Let man design, perceive threat, nervous system outdated. These are all the things what I noted in my notepad. By doing regular practice, we can activate our ventral vagus system. That time I had a question: what practice we have to do? But while following the PPT, I get answer for all the questions. It's really very interesting, doctor. Thank you very much.
Okay.
Thank you very much, doctor. I'm Ravi Kiran here. I'm a practicing hypnotherapist. I do talk about these flight response and some autonomic nervous system. You have added the vagus nerve and those things. I'm actually keen to read more about it and then pick up some books and read. And I heard about this book, Body Keeps the Score, because there are some people who actually use the body to heal the mind. Somatic
That's why I
integration.
keep emphasizing when there is trauma, unless otherwise you address the body first, you cannot like addressing the thought and then addressing the emotion and then addressing the body. So many people try to address the thought and that fails. When you try to address the emotion, it fails. But when you address the body and you heal the body and then you heal the emotion and then you come to the thought, that's the hierarchy that I was trying to emphasize in trauma work.
Absolutely, I agree with you. I have experienced in my practice that there are some people who get into the freeze actually, unless you make them aware of the sensations in the body and touch them and get the emotions out gradually, you cannot really do any psychological counseling or anything like that. Excellent presentation I've heard, and it has been, you packed so much of information that it is difficult to remember and comprehend. If I could get the recording, I will listen to it over and over again to get it.
Like I had a extended version, then only I realized that's too much for 1 hour. So I had a shortened version, and only after presentation I realized even this is little more. But most of them were repetitions, like WHO presentation, ventral vagal, sympathetic, dorsal vagal. These three states, you understand, that's enough at this point. That's all.
Yeah, but excellent. I mean, I'm grateful to you that I have attended, and grateful to you that you have given us all this information. Thank you.
Thank you, sir.
Dr. Srinidhi, you want to ask something? Go ahead. Unmute. Unmute first.
Yes, sir.
Go ahead.
So, good evening, sir. So, it was a wonderful session. So, it was a wonderful session, sir. It's such a nice presentation, sir.
For
And I
1
think
minute more. For those of you who don't know, Srinidhi says my colleague, he just sits next my room, but we very rarely get an opportunity to meet. But today we spent more than an hour together, and says my therapist when I am in stress.
Great. Go ahead.
We all need each other, sir.
Srinidhi now.
So wonderful presentation, and I think you put across everything and it in a very simplified way, sir. So I think it's good to go back to physiology and understand what we are doing in everyday practice. We actually do most of the things, but to understand how it helps and how it reaches out is beautiful, sir. Very nice presentation, sir.
Thank you. You made my day today by being here.
Thank you.
Right. Thank you. Thank you.
If there are no questions, let us give a big hand to Dr. Srinivasan. Unmute and clap. If you mute and clap, you can't hear. Unmute and clap. Namaste, Dr.
Okay, probably we can concluding
good.
remarks and we can finish its time.
Thank you. Who's giving VOT?
Can I go with VOT, sir?
Yeah.
Please go ahead.
On behalf of all the participants, I extend our deepest gratitude to Dr. Srinivasan sir for this enlightening session on mysteries of the wandering vagus, how to use it to our advantage. Sir, your insights into the vagus nerve's journey from primitive protection in invertebrates to the relational intelligence of the mammalian ventral vagal system were truly eye-opening. You gave us not only a scientific roadmap, but also practical tools to navigate states of shutdown, states of stress and connection. Your explanation of neuroception, co-regulation, and the autonomic ladder helped us see that healing is not just clinical, it is relational, embodied, and deeply human. The hopeful message that our nervous system can change glimmer by glimmer resonates with every clinician and every caregiver present here today. Thank you for guiding us with clarity, humility, and grounded expertise. A heartfelt thanks as well to our organizing partners, Yellow Pond Counseling Center, Forest Creative Arts Studio, Sridipti Counseling Center, Clover Learning Center, Srisha Counseling Center, and Mindstyle Hub. Let's carry this forward in our work, our relationships, and in ourselves. Thank you. Thank you, sir.
Thank you, Dr.
Thank you, Dr.
Srinivasan.
Srinivasan.
Thank you, Sunanda ji. Thank you, Anna.
Bye, friends.
Thanks a lot, Dinakar Rao
Thank
sir
you, sir.
and Dr. Srinivasan garu.
Thank you. Thank you.
Thank you.